All right. So we got off track a little bit, but I think that was good learning. Okay. So now what we want to do is measure the ostia of the left atrial appendage. Okay. So reset your images. And so the official way to do this is to find the circumflex. Okay. So what we're going to do on the axial images, we're going to scroll up. And this has a variant anatomy, so it was probably not the best case to do it on. But there's a wimpy little teeny tiny circumflex right here. So you take your dot and you put it on the circumflex. And then you angle, so that's now in long axis. So right here. So now you go into the two-chamber view here. And you're going to take this, and this is Coumadin's ridge right here. And you're going to angle up, so you've got a plane through this ostia of the left atrial appendage. I'm going to show you this in, I think I'm going to do this in MIP. So if you do a MIP of this, you can see how we are cutting through the base of the, here's the left atrial appendage, here's the pulmonary vein. Here's the left atrial appendage. Everybody see that? This is where the ostia of the left atrial appendage from the left atrium is. So I'm going to change this back to MPR. So we've got the circumflex right here. So if you ever want to see where you are on the axial plane, it's perfectly okay to explore. So you say, hey, this, I believe this right here, and I'll zoom this up. So you say, okay, right here is where is right here. If I move to the other side over here, see how this moves over to the ridge over here? So feel free to interactively explore cardiac anatomy and see which side is which, right? So you can see how when you move this, you get to different spots, okay? So what we want to measure is this oval structure right here. So we'll just do Control D, and I'll click here, and voila, that is the ostia of the left atrial appendage. If we were doing the amulet, you want to go in, but you don't want to include that little accessory lobule there. You want to close it before that, so you'd probably measure it right here. This might not be the best one for that device for that very reason, because it's not as deep as they want to be. So you do Control D, you click and then drag, and it will give you the area, the diameter, and the perimeter. Okay, so that would be the potential landing zone. If you were doing a Watchman, you find the ostia here, and you want an area that's about 10 to 15 millimeters deep. So what you do is you angle this up like this. And see, now you've got this circle here, and you do Control D, and you've got the landing zone there. Okay? That makes sense? The other dimensions that are valuable is you measure these depths and the length of the appendage. There's probably 1 million measurements you could make of the left atrial appendage, but whoever's deploying the device is going to size the device, wants to make sure there's enough space for the device. It's kind of like the 3 bears. Can't be too big, can't be too small. You want the device to be just right. Okay, any questions about that?